This is the Body Scan CD. Settle down in a chair or on a flat surface, making yourself comfortable as best you can. Allow your eyes to close gently if that's comfortable for you. It's also fine to keep your eyes open. If you're sitting, bring your awareness to how you're sitting in the chair, where your body makes contact with the chair. Sitting with your legs uncrossed and your feet flat on the floor. Your lower back can be supported by the back of the chair, making a stable base for your upper body. Gently guiding your chest to be slightly uplifted, and just let gravity allow your shoulders to drop gently back and down. Your head is centered, balanced comfortably between your shoulders. Allowing the crown of your head to be lifted toward the ceiling and your chin to lower slightly. Intentionally adjusting your body this way allows you to take on a dignified sitting posture. If you're lying down on a flat surface, allow your legs to be uncrossed and rest comfortably on the flat surface. If it makes your lower back more comfortable, you may want to place a pillow under your knees to lift them slightly. Allow your arms to rest naturally at the sides of your body, with your palms facing up, if that's comfortable for you. Now I'd like you to gently begin noticing the breath. It's a constant feature of life. It's so constant that it's easy to ignore. So taking some time now with it, actually feeling the sensations as the breath enters the body and leaves the body of its own accord. Allowing your breath to move through its cycle of in-breath and out-breath without needing to control it or make it do anything. Just noticing and feeling the breath moving in and moving out. And now, as it feels right to you, bring the attention to the belly, the lower abdomen, noticing that it may be rising and falling with the cycle of the breath. And as you feel ready, placing your hands on the belly, feeling the movement of the breath, the rhythm, the waves of the breath. Simply riding the waves of the breath from moment to moment, breath by breath. And as you allow your attention to follow through this guided body scan, if at any time sensations in the body become too uncomfortable or emotions arise that are too difficult, knowing that it is always possible to return to the breath as a safe place, a haven. So now, if you've placed your hands on the belly, go ahead and take them off, placing them in a comfortable position in your lap, or with the palms resting lightly on the thighs. and moving your attention to the feet, feeling where they are, sensing the place right here where the soles of the feet are meeting the floor. The attention dwelling right here where the soles of the feet meet the floor. Feeling the groundedness and noticing throughout this scan of the body that we're beginning that sensations may arise when you bring attention to a particular part of the body. Maybe tingling, maybe pressure, maybe a feeling of the breath or the pulse affecting this area. Or perhaps there's no sensation. That's okay. That's simply your experience of this moment. Now that you've connected with the sensations of your breathing, expand your awareness to your entire body. Be aware of the sensations of your entire body as it breathes in and as it breathes out. And expanding the attention now to both feet, the ankles, the lower legs, the calves and shins, noticing the point of contact or lack of contact with the chair. Be aware of gravity, aware as well that the legs are alive. How does the breath affect the legs? How about the pulse? Is there a sense of the blood flowing inside the legs? Shifting the focus now to the upper legs, the thighs, aware of gravity's work, the pressing against the chair, aware of the feel of clothing against the skin, and noticing the quality of the muscles, tight or loose. And is it possible to sense and feel these large bones here? And now, as it seems right, moving the attention to the pelvic region, from hip to hip, aware of the effects of gravity, the weight of the lower body, the buttocks pressing into the chair, the sensations in the hip joints and the groin, the lower abdomen, tuning in to the sense of the breath, of the pulse here, and noticing thoughts and feelings that may arise as your attention dwells in this area. And as best you can, just letting any thoughts and feelings pass through like clouds in the sky. And now expanding the attention into the abdomen, the belly, feeling the inside first, this place where we have our gut feelings. There really are nerves here that sense and know. Feeling into the emotion of the diaphragm, the sense of the breath in the belly. And as you feel ready, Moving the attention to the chest, aware of the lungs and heart in this space. Maybe sensing inside as the lungs fill and empty. Perhaps noticing the heartbeat, the rhythm of the heart and the breath together. Being present right here in the sensations. Right here in the feeling, the touch of clothing, any sense of movement in the body. Moving the attention now to the lower back, to the sense of contact or lack of contact with the chair. Allowing the attention now to travel to the middle and upper back, sensing the muscles tight or loose. Aware perhaps of sensations of the weight of the body here. Pressure against the back of the chair. Feelings of the texture of clothing. Noting how the breath moves in this area. And now experiencing the entire back, dwelling in the sensations of the back, just noticing what the back knows. Moving now to the shoulders, into their condition in this moment. Any tightness or softness, recognizing that this is the condition right now in this moment. Accepting this as it is, knowing that it does not need to be some other way. Shifting the attention now to the arms, to the upper arms and forearms. Aware of the pull of gravity, the weight of the arms, feeling the muscles and joints, the touch and texture of clothing, and expanding the attention now to include the wrists and hands. Noticing sensations of warmth or coolness, tingling, moisture or dryness. How does the breath affect the arms and the hands? Is it possible to notice the pulse here? Just being with what's here right now. Now moving the attention to the neck, noticing how it is right now in these big muscles in the back of the neck. What's it like there? From the base of the skull to the shoulders, around to the throat. Aware perhaps of the play of air, the touch of the clothing. Just being present in this experience, right here. And now moving the attention to the top of the head, noticing any sensations that may arise when you bring attention here. Maybe tingling, maybe pressure, maybe a feeling of the breath or the pulse affecting this area. And when you're ready, moving your attention to the forehead, observing any sensations here, perhaps furrows of tension or tingling or a sense of relaxation. And being aware of that little space between the eyebrows and how you're finding this right now. Allowing yourself to feel whatever you're experiencing here, right now, with the forehead. Now moving your attention from the forehead to the eyes and the eyelids. When it feels right, also beginning to pay attention to the cheeks, sensing the bones, the muscles, sensations of coolness or warmth. Maybe noting that some sensations stay for a while and others pass quickly, and that intensity of the sensations may change one way or the other as you bring attention to them. And bringing attention now to the nose, from the bridge to the edges of the nostrils. Perhaps feeling the breath in the nostrils as it enters and leaves. And just below the nose, on the upper lip, noticing the temperature, any moisture, sensations right here on the upper lip. Moving the attention now into the jaw, becoming aware of tightness or softness here. Noticing any changes that might be created by just this small movement. Any changes in sensations of the muscles in the face and neck or in other parts of the body. And now expanding the focus of attention to include the mouth and lips, especially that place right here where the upper lip meets the lower lip. Aware now of the inside of the mouth, the tongue against the teeth, the tongue against the roof of the mouth. And just breathing now through the lips for a couple of breaths. Becoming aware of the sensations of the air on its way out and in. Observing any sensations of dampness, dryness, warmth, or coolness as you breathe in through the nose and out through the lips for a couple more breaths. And expanding the attention now to encompass the entire face. Not a picture of your face in your mind, but really feeling the sensations right here in this area that we call the face. What's here for you? Aware of any thoughts and emotions as well? And if thoughts or emotions arise, allowing them simply to come into awareness and pass, like clouds in the sky. And now expanding the attention to include the entire body, from the soles of the feet to the top of the head, being present to the entirety of the experience of sitting here in this moment. As you continue with the body scan, if you begin to feel drowsy, just note that and bring your attention back to scanning the body. You may wish to open your eyes when you begin to feel sleepy, either keeping them open for the body scan or opening and closing them as needed. The attention will inevitably wander away from the breath and the body from time to time. That's entirely normal. It's what minds do. When you notice it, gently acknowledge it, noticing where the attention has gone off to, and then gently return your attention to the part of the body you intended to focus on. After you've scanned the whole body in detail, the way we've just done, simply allow your attention to expand back to an awareness on your entire body and the breath within your body. In this way, spend a few moments being aware of a sense of the body as a whole and of the breath flowing freely in and out of the body. And when you're ready, you may wish to wiggle your hands and feet a little bit, bringing a sense of awareness outward back into the room. And whenever you're ready to do so, you can open your eyes.